The eye is like a camera. It is able to focus light through the cornea and the lens onto the retina at the back of the eye to give a clear image. Some eyes do not do this perfectly. Their lens is a bit too strong or weak, or the eye is a bit too long or short, or the cornea is a bit too curved or too shallow. This means that a person will have to wear a pair of glasses to get good vision. Now, when we do cataract surgery, we have the opportunity to correct this. We take out the contents of the natural human lens, leaving a little elastic capsule behind. We can then choose a plastic lens of a certain strength to insert into this capsule. And this often means that patients do not need to wear glasses after surgery. Well, there is a caveat to this. A person will usually choose to be without glasses for distance or without glasses for near after cataract surgery. You can watch my other video on this, as there is quite a lot to say about this choice. But to return to this video again, a great outcome of cataract surgery would be that a patient can see perfectly at their preferred distance without glasses, for example, for driving. So we have essentially incorporated the strength of the glasses that the patient might have worn before cataract surgery and put it into the eye. Now, there are two main things to know about this. Firstly, we cannot always predict exactly what lens strength is perfect for an eye. So some patients do find that they need a bit of correction still with glasses after surgery. But more relevant to this video is that some eyes present another challenge to choosing the perfect lens to place in the eye. What I'm talking about is when the eye is rugby ball shaped rather than football shaped. Specifically, the shape of the cornea. This cornea here is smoothly curved like a football. Both side to side and top to bottom, the curvature of the cornea is the same. And we can add some colour to this to demonstrate this. But let's look at what another patient's eye might be like. In this exaggerated view of how a cornea might be, we can see that the cornea is steep top to bottom and shallow side to side. If we cut the cornea in half, we can see how this curve changes depending on whether we see it from the side or from the top. This is called astigmatism. The problem with this is that this patient will still need glasses for clear vision after cataract surgery. Here are some glasses, and the optometrist would need to provide a lens in the glasses that, rather than being a smooth, football-shaped lens, is one with a more rugby-shaped lens. We can see this again with this colour that we have added to demonstrate this. And again, if we cut into the lens and look from the side and then the top. The optometrist would need to align the lens opposite to the curve of the cornea to cancel out the abnormal shape of the cornea and give good vision. Now, this all sounds quite frustrating, but the good news is that there is a potential solution. There is an opportunity to incorporate this curve into the lens that we put into the eye during cataract surgery. This is to avoid needing to have glasses after surgery that have the curvature built into them. So here is a normal lens, but we have the option of inserting a different lens where the shape has been changed to include a different curvature in one direction compared to the other. I've deliberately exaggerated how different the curve is just for the purposes of this video. When the lens is put in the eye, it will be carefully aligned to counteract the corneal curvature, the corneal astigmatism. This is really a great technology, and there are really only three downsides. Firstly, there can be a higher cost for this type of lens and surgery. However, when one considers the possibility of not needing glasses after surgery, this may actually be more cost effective. The second downside is that we cannot always guarantee that we totally eliminate all the astigmatism. It is therefore possible that for the best vision, glasses are still needed after surgery. This can be the case because there is remaining astigmatism, or it may occur because the overall strength of the lens is not exactly right for the eye. It is not fully possible to eliminate this risk, but usually patients are still very happy as the vision is clearer than it was before surgery, even if they do sometimes need glasses for particular activities. Lastly, sometimes the lens that we put in the eye moves a little in the first few days after surgery. It can rotate so that it is not exactly aligned with astigmatism, and so it does not reduce the astigmatism as much as we had planned. If this happens, your surgeon will discuss with you whether a second operation to rotate the lens back into the correct position would be of benefit. If there is a very small misalignment and your vision is good and astigmatism is minimal, it may be best to leave it. If further surgery is performed, there are very small risks to this surgery, and your surgeon will discuss this with you. Now lastly, this lens is called a toric lens. I want to explain why this is. Here is a model of a classic Greek or Roman column. At the bottom of the column, one finds a donut shape called a torus. This has one curve in this direction and another larger curve going around the column. If we cut a little bit off the torus, we get a toric shape. Shallow in one direction, steep in the other. And this is how a toric lens is shaped. So that is a summary of toric intraocular lenses for the correction of astigmatism. It's a great technology that in many cases I think is a wonderful solution. If your optometrist has told you that you have some astigmatism, then when you see your cataract surgeon, it's worth asking them whether a toric lens might be of benefit for you.